Old Fadama is located along the Odo River and Korle Lagoon. The community is characterized by dilapidated housing, overcrowding, poverty, and poor sanitation. Meeting the most essential elements of human sustenance is a huge struggle for many residents of Old Fadama. Due to the poor sanitation, it is not surprising to know that ill health is a very common feature among residents. And imagine my shock when I found that the community of over 80,000 people lack a health post. But my shock might be unwarranted if you consider several moves by past administrations to relocate residents here. Nevertheless, the lack of a health post is telling on the community.
Obi wo krompo niska na odi kokwalebu se wonim se kwalebu tia woniska wontimi ko ho no enti wo yare na wokunu niska eyi pra na okofa bia abrawo na yare na nidi eyi sa prastamol no wo se na ewu
ye be ko hospital agi kwalebu ananse he reach Osha clinic ne ho niema enti ye hanom nkasa de ni hospital enti ti se anaju se obi yemu kano ananse bibi kanipa no a gi edwane akọ kwan na no ne yakopeka ansa na yaba inside ho abepe kwan ya ebefa so a edi nipa no bedru hospital obi o maybe before odi no bedru hospital no na wonsanya onipa bio
esisie pa no musisie no ese entimi masai na Ghana fo a yawo ha mumu ye ti se asa ye free obi man na aba ha no san asa esisie mai.
To cater for their health needs, the people have resorted to herbal medicines. Self-medication is rife as many resort to over-the-counter drugs. Others unknowingly abuse medication, leading to some deaths, as community leaders suggest. Interestingly, for those in the brothels, they smoke weed or marijuana to keep themselves healthy and fit, although they want a hospital to be built here. Although it is not safe for those who patronize the over-the-counter drugs, it is a good business for those who sell them, most of who do not have licenses to operate a chemical shop or a pharmacy. There are not less than 20 to 30 chemical or medicine shops in this slum without licenses. Medicines are even sold in electrical shops, provision shops, and even tailoring shops.
I don't turn the new by and I say, hospital Papa Bian Silenia, and Ghost on a ton of crack and the woman. But like I started to say me a dear and Chibiasa. Oh, I feel I'm 1 year criminal.
This one-room shop, where these women were waiting to be seen by someone they call doctor, is run by one of the residents with the help of a lady and another man. Although management of the center refused to talk to us on camera, we were told it is serving as a hospital for the community. Of all the shops we visited, we only got one licensed chemical shop. The owner, who showed us his license from the Pharmacy Council, was not happy about how many people have turned into pharmacists in the community.
None of the shops you have seen around here has got a license apart from this drugstore. Anybody who gets up nowadays and he had even one CD will open a drugstore. So because of that fact, our market is now totally down. It's totally down because of the way the drugstores are spread all over the area. And I don't know, the Pharmacy Council is not doing anything about it because they are saying this place is illegal settlement. No, even if it is illegal settlement, you can see there are people still living here. And they are being polluted. They haven't gotten any train. They have not gotten any formal train to sell these drugs. Somebody can even just be maybe a scrap dealer. The next day you see the person is selling drugs. Somebody can be doing maybe provision shop. They are not buying. The following day you see the person, he is selling medicine.
What residents and leaders here want now is for government to come up with a clear-cut policy on how to develop slums in the country, particularly Old Fadama, since it has become difficult relocating them.
All I can see is over-the-counter medicine shops. So it means that is their first point of call when they are sick. They just walk into over-the-counter medicine. And even the negative impact of just taking medicine without the proper prescription is something that I cannot even think about. Yeah, so I think that government should look at that and deal with that, because even if you are thinking of resettling them, but in the meantime, they would need these things too for life to go on.
Many residents of Old Fadama will continue to die or suffer the consequences of drug abuse if nothing is done immediately. Alice Aite, GH1 News.